Welcome all nursing officers to exam preparation part 3. Same as in other exam preparations, this video also has 3 parts. First one is multiple choice questions, second one is topic presentation with animation or pictures, and the third one is memory tricks and tips. Let us go to the multiple choice questions. Read the questions carefully and choose the right option. Answer key is given at the end of the session after the memory tricks. Now, let us go to the topic presentation with pictures and animations and tables. First, we are going to see the pituitary diseases. Froehlich's syndrome. The other name is adipocogenital dystrophy. Next one is Lorraine-Levy syndrome. It is pituitary dwarfism. third one is Sheba syndrome, which is due to the postpartum necrosis of pituitary. The last one is Sever's disease, which is cachexia hypophysiobreva. Now let us see the signs and symptoms with animation for this pituitary disorder for more explanation. Fowlick syndrome is obesity. You can see the picture. Laurent-Lévy syndrome is dwarfism. We already discussed about that. Sheba syndrome will be due to the severe bleeding which will follow the childbirth and it will damage the pituitary. Simon disease, you can see the picture, cachexia features. Now let us see the adrenal disorders. First one is Cone syndrome, which is primary aldosteronism. Second one is salt-losing syndrome or salt-wasting syndrome, which is congenital adrenal hyperplasia. Now let us go to the disorders of blood vessels. First one is Takyasu arteritis, that is also known as Pulcer's disease. It affects the aorta and its branches. Next is Buerger's disease. Other name is thromboangiitis obliterans or TAO. This is inflammation of peripheral arteries. Next is Raynaud's disease, that is narrowing of arteries in finger and toes and shutdown. Then Henkos-Krolin purpura is the inflammation of small blood vessels of skin and joints. This area should be remembered separately because the multiple choice questions there will be confusion. Now let us see the lymph node disorders. First one is Kawasaki disease, which is mucocutaneous lymph node syndrome. Then Kikuchi disease or KFD, which is necrotizing lymphadenopathy. Next one is Kimura's disease, which is painless lymphadenopathy. Next is disorders of neurons. First one, carpal tunnel syndrome, which is compression of median nerve and it will affect us wrist and hand pain. Next is tarsal tunnel syndrome, which is the compression of tibial nerve, which will affect us ankle and foot pain. Morton's neuroma is also called interdigital neuroma. This is due to the thickening of tissue around the nerve supplying toes. Acoustic neuroma is the benign tumor of 8th cranial nerve and it will affect the hearing. Next we will see about the skeletal system. The first one is Pott's disease, which is tuberculosis spondylitis or TB of spine. Pagets disease is the degenerative bone disease. Treacher-Collins disease is the underdeveloped facial bones. Still's disease is the arthritis of spine or sacroiliac joint. Then Perth disease, here the head of femur softens and breaks down due to low blood supply. Next we will see some cancers. First one is Ewing tumor, which is high malignant sarcoma of bone marrow. Next is choriocarcinoma. The term chorio will refer to the uterus, so this is fast growing cancer of uterus. Lynch syndrome is hereditary colorectal cancer. Leiomyoma is fibroid uterus. Kaposis sarcoma, it is an important thing, which is cancerous skin lesions of soft tissue seen in HIV or AIDS. Some other diseases we will see. Reiter's syndrome, it is reactive arthritis. There is a triad, 3 symptoms: urethritis, conjunctivitis and arthritis. Next is Cartagena syndrome, which is also called immotile cilia syndrome. It is autosomal recessive genetic ciliary disorder. The triad is bronchiectasis, situs inversus and chronic sinusitis. Immotile sperm is seen in male patients. Now let us see about Korsakoff syndrome. This is a complication of thiamine or vitamin B1 deficiency seen in alcoholics. Wernicke encephalopathy is also associated with the thiamine deficiency. The triad is altered mental status, nystagmus, this is the involuntary movement of eye, and ataxia, that is the impaired balance or coordination. Next is Marfan syndrome. This is a genetic condition that affects connective tissue. Features are long and narrow face, tall and thin body build. Crohn's disease and Hirschsprung disease. Crohn's disease is a regional enteritis. It's a type of inflammatory bowel disorder. And Hirschsprung disease is megacolon. It's absence of ganglion and failure to pass stools. The last topic is oxycephaly and scaphocephaly. Oxycephaly is the top of skull is conic or pointed. In scaphocephaly, the top of skull is boat-shaped. Now let us see about some memory tips and tricks for connecting the topics. This will help you to avoid confusion about various options in exam hall. The tips for pituitary diseases. Fowlix fat, connecting with F letter, and fat is adipose, so it is adipose-genital dystrophy. Lorraine-Levy is dwarf, it is pituitary dwarfism. Sheba postpartum hemorrhage. Simon's cachexia. Some tips for the bleeding disorders. Takayasu facialis aorta. Buger TAO. Thromboangiitis obliterans. Raynaud femoral dose. Next, carpal medial nerve, tarsal tibial nerve. T is highlighted here. Morton's toe and acoustic 8th nerve, which is hearing. Leving's bone. Choreo, we already know, is term for uterus. Leo fibro, Lynch colorectal, and Capos HIV. You see the green highlighted areas EB, LF, LC, KH. So EB is Evin bone, LF is Leo fibro, LC is Lynch colorectal, and KH is Capos HIV. Reiters, the short form is ACU. Arthritis, conjunctivitis, and urethritis. Korsakoff, it is Wernicke's vitamin B1 or thiamine. Short form is ANA, that is altered mental status, nystagmus, and ataxia. Marfan, long connective tissue. So long is the feature and connective tissue is the affected area. Oxy, cone-shaped, and scapho, boat-shaped, the skull features. The answer key is given here. Please check your answers and redo the exam till you get 100% of the result. Thank you all for watching this video. Please add your valuable feedback. Subscribe this channel for more exam preparation videos. Thank you so much.